cross path with her. And of course, tonight is a very interesting topic. Yeah.
This Zovi is a gynaecologist.
Yeah, we would appreciate if all of you can mute the mic just to avoid the background noise so that everyone can enjoy this talk tonight. So if you still have friends who have yet to join, please feel free to share the Zoom link with them. At the same time, we are also live stream on our VDEX team Facebook page. Yeah, you can go back and check that out later for more information on the health tips. Okay, so once again, welcome all of you. Do share with your friends if they have not yet come in. I'll be the host for tonight. My name is Fion. Okay, so without further ado, let us start with our chat tonight with Dr. Zovi. Okay, so before I start, let me introduce our team to you. Okay, let me share the slides for tonight. Okay, maybe one of you or some of you can give me some response. Are you all able to see my slides that just launched on a full screen? If you can see my slide, please give me a triple A. Yes, can see. Thank you very much, Kaishin. Thank you so much for joining us tonight. Thank you everyone for your response. Okay, so we are from the Visionary Dream Express in short form. Sometimes we call ourselves VDEX. So VDEX, our dream is to together building and inspiring people to live their dream. Okay, of course, everyone's dreams could be in many different ways. Someone to live healthily, some wants to have more wealth, someone to have some people want to have time freedom with their family, right? So in here VDEX we will be able to help people to achieve their dreams in all of the different ways that they wish to. Okay, and then, of course, VDEX here, I'd like to share with you, VDEX is formed by our VDEX founder, Dr. Tam, and also Dr. Wei. Both of them are also a very experienced naturopathic doctor who have experience of over 20 years. And throughout all these years, they have already helped tens of thousands of people to recover their health through the natural holistic health. Okay. And then also VDEX also comprises of this group of VDEX international directors. They come from different backgrounds. Like we have medical doctors like Dr. Chia, some are nurses, some are physiotherapy, some are chiropractors, and also some are entrepreneurs and like the Meridian chiropractors as well. Okay, so VDEX here we have people from all walks of life, but they all have the same objective, that is to share natural health to inspire more people. Okay, so without further ado, let me invite our VIP, our guest tonight, which is Dr. Zovi, who have over 40 years of experience as a consultant, ops and guys, and she's also my personal gynae as well. So let's give her a lot of here in the Zoom is like a applause. Okay, so let's give us a warm welcome by typing a lot of in the chat room to welcome her. Okay, so welcome Dr. Zovi. We are very glad that you are here with us tonight. Yeah, good evening, Dr. Zovi. Nice to see you.
Hello, good evening, everyone. I'm so happy that you can all come together so that we can talk about vulval and vaginal health, which is very important for all the females. But some of you may say, I'm not a female, I have no interest in this. But I know all of you have a mother who is a female. And some of you may have a wife, daughters, or sisters. So even though you are not a female, it is very important for you to know about this problem. God has made us females a very special species because He has given us reproductive organs in such a way that we can bear children. And if we cannot bear children and men cannot bear children, there will be no future generations. So our female health is very, very important so that we can preserve our future generation. So the talk we're talking about is very important for everyone from the time we are born till we are in old age. The next one is the picture. Can we have the other picture? Yeah, this is vulva. Vulva is the one that you can see from the outside. It contains inner lip and outer lip and the urethral opening, vaginal opening, the clitoris, and also it has a mons pubis, and you can see some hair up there. Next one, please. Then what is a vagina? Vagina is a muscular canal that extends from the vulva to the cervix. Functions of the vagina are: one, passage of blood for mucus during menses from the uterus to outside, and it receives a penis during sex, and it holds the sperm till they pass into the uterus. And this is the passageway for childbirth. This is the shortest journey for a child to go through, but the longest time that it takes to travel, about 6 to 8 centimeters. It takes few hours. And this is something that cleans itself. Okay. Why is vaginal health important? We all know that our overall health is important. Just as our overall health is important, our vaginal health is very, very important, because if we are not healthy there, it can affect our fertility. And if we are not fertile and cannot have children, if that happened to all of us, then there will be no more generation. Healthy vagina is very important for healthy sex and orgasm. Lactobacilli is a normal vaginal bacteria which keeps the vagina acidic, and it prevents the overgrowth of unhealthy bacteria that cause infection. Vaginal discharge and bleeding between periods alerts a person to other female health problems, because you shouldn't have any bleeding between periods. Vaginal issues can indicate serious problems like sexually transmitted diseases like AIDS, or it can show that you have reproductive tract cancer. Next one, please. Hello, can we have the next slide? Signs of healthy vulva and vagina. So the vulval skin should be clear and no rash, no irritation, no swelling, no pus, or anything that is not like a clear skin, and there should not be anything that cause you any concern. And clear whitish vaginal discharge with no fishy or foul smells, and inside the vagina is moist, supple, and elastic. There is no itching or painful urination or pain during sex. Now, the vagina is kept healthy by a hormone called estrogen, and this makes the lining thick and supple. And it also helps a good bacterial balance, which protects the vagina from harmful diseases. Because if there are harmful bacteria in the vagina, it means you may have vaginal infection. What can affect our vaginal health? There are many things that can affect us. One is pregnancy and childbirth. During pregnancy, the discharge in the vagina increases a lot, but at the same time, it should not be like curd, or it should not be smelly, and it should not be irritating. And because of childbirth, there is stretching of the pelvic muscles, and so the vagina can be looser than normal. And sex should not be painful, and it should be enjoyable. But if there is some problem like sexually transmitted diseases and injury, sex will be painful. And so the vaginal health is affected. And birth control of different kinds And feminine hygiene products can cause irritation to the vulva and the vagina. And hormone levels are very important, especially estrogen, which changes a lot during the period cycle, the menstrual cycle, and also during pregnancy and lactation. And health conditions and treatment can cause problems to our vaginal health. Endometriosis can occur inside the vagina, and also pelvic inflammatory diseases can cause painful sex. So all this can affect our vaginal health. Okay, what are the common problems that you face? Can be abnormal bleeding or abnormal discharge, or the vagina, we say, should be supple and elastic. This elasticity may decrease due to a drop in estrogen, and also delivery can stress the muscles, so it's lax. And sexual problems of any kind, as well as sexually transmitted diseases like AIDS, herpes, gonorrhea, chlamydia, genital warts, and syphilis. Vaginal problems can infection which may not necessarily be sexually transmitted. And sometimes some people say, oh, Dr. Zovi, something is coming out from my vagina. This is called pelvic organ prolapse. Other things are vaginal cysts, vaginal cancer, and also vulval cancer. And even there also you can have endometriosis and also vaginal fibroids. And can we have the next one? So how should we maintain our vulvovaginal health? We should clean the private areas gently and pat it dry and not be so rough in trying to clean it. It's best to wear cotton underwear because it can breathe, whereas the others cannot really breathe, and then the vagina is moist all the time. And when it is moist, chances of bacteria, unhealthy bacteria tends to grow there. And when we go to the toilet, like we pangsai, we should wipe from the front to the back. And if you pass urine, you should wipe from above downwards, so that the bacteria from the vagina, from those areas will not go into the vagina. And pads should be changed frequently during a period. Some people may say, oh, it's towards the end of my period. I don't need to change at all for the whole day. You still need to change for hygiene's sake, not because it's wet. Safe sex. Okay, the best safe sex is to have one sexual partner who also have just you as a sexual partner. And it is best to use condom if you want to be even safer, if you don't want to be pregnant. And it's good to take HPV vaccine. This is a vaccine to prevent cervical cancer. Do Kegels exercise. Kegels exercise is to prevent the looseness of the pelvic muscles. So I think you all, or most of you might have experienced, you want to go to the toilet or you have diarrhea, but there is no toilet and you have to hold on. So you have to contract your pelvic muscles. That's the way you do Kegel exercise. You contract it for some time and then you relax. Contract, relax. You can do that anytime, anywhere, while waiting for your bus, waiting for the doctor, or even while you're just standing in a queue. Also, very, very important is to have regular gynae checkup, because many times there are no symptoms, no complaints at all. I remember one person who came, said, I have no problem, I just came for checkup. But when I look at her, she had stage 2 cervical cancer. And that particular person already had a checkup 6 months before that, and everything was okay. And 6 months prior to that, she saw, that means I was the third doctor who saw her during 1.5 months. And by the time I saw her, that time she already had stage 2 cervical cancer and she had no symptoms at all. So it is very, very important that you have a regular gynae checkup. During the gynae checkup, normally we check that. Excuse me, I just need to drink. So during the gynae checkup, we check the health of the vulva, the vagina, if there's any abnormality and any abnormal discharge. And we also do what we call a pap smear. This is to find out if there are any abnormalities or any signs that may cause cervix cancer. This can be detected much earlier than you can see with the naked eye. And also we do what we call HPV DNA. The HPV is a virus that causes cervical cancer. So if you do not have that HPV infection, it's very, very unlikely to have cervical cancer. But if you have it, you need to take care of it and have regular checkups, especially. And then what are the don'ts? Many people think that they need to clean inside the vagina by douching or washing the vagina. Some people say, oh, I wash my vagina. There is no need to do that at all. Actually, when you do douching or cleaning the vagina, you introduce some bacteria and the chances of having vaginal infection is greatly increased. And you should avoid all this, what they call feminine wash for feminine hygiene sprays, perfumes, etc. These are all marketing gimmicks, so don't fall for it. You should avoid synthetic and tight underwears because these cannot breathe and the vagina gets moist all the time. And when it is moist all the time, it's a good area for bacteria to grow. It's best to avoid shaving and waxing to prevent infection. And you should avoid sanitary pads or panty liners unless you have a period or you have some discharge. But if you have discharge that is not normal, you should see a doctor. And it is best to never smoke and don't take alcohol. There is no safe limit for alcohol. Even the smallest amount can affect your overall health as well as your feminine health. So how should we also do help our reproductive organs? We need to take healthy food and good supplementation. When the gut is healthy, vagina will be healthy too. So what are the foods that we should take? Yogurt and other fermented foods, because this contain healthy bacteria. Some of the other fermented foods are kimchi, miso, miso and what is that one? Tempeh, yes, correct, tempeh. Thank you. Other things are kombucha, kefir, and all that. Any of those will do. And cranberry juice is a very antioxidant, which is very powerful in fighting infections. And pineapple improves gut health. Anything that improves gut health also improve our vaginal health. And apples stimulate the blood flow in the vagina, and it helps in sexual arousal. So let's take all these things also. There are other foods that are also helpful in our vaginal health. Next slide, food. Some are ginger tea. These have antimicrobial properties and they promote gut health and vaginal health. And lemon is very rich in vitamin C and it maintains the vaginal pH, which should be acidic. And celery also have vitamin C, which help restore the ecology and vaginal bacteria. And cinnamon, which I love very much, I like the smell. It helps to neutralize excess acidity in the vagina. So we may be eating all these good foods, but why do I need supplementation if I eat all the good foods that are supposed to be healthy for me? The problem is many of us do not really eat all these foods that we know are good for us. And also the soil that these foods are grown may be depleted in the nutrients that they are supposed to have. So it is good to take supplementation that will be not causing us any harm, that would not have any overdose. So let us see what are the supplements that we can take. Okay, one is called for life transfactor Riovida. This is very powerful antioxidant. It's the only transfer factor in juice form and also the only antioxidant juice that have transfer factor. So this is the best antioxidant juice that you can take in the world at the moment because of the transfer factor. It offers antioxidant and immune support. It contains antioxidant-rich superfruits like pomegranate, acai berry, blueberry, elderberry, purple grapes. And you just take 130 ml cup daily. So can we see the next one? What else can we take? Another thing is for life DF plus advanced. This have a high level of immune support. Each of this capsule contains 100 milligram of transfer factor and 10 immune supporting herbs. These herbs include cordyceps, beta-glucan, agaricus, olive leaf extracts, and different kinds of mushroom, including maitake and shiitake mushroom. You should take 3 capsules a day. Okay, is there any other things that we need to take? Let's have a look. One is called For Life DF Belvy. It helps with women's health balance. Not only for women. Recently, I learned that men are also beneficial. It's also beneficial for men. It is good for men and women's overall health. The things that it include are kudzu, red clover, and flax. These are the ones that balance the female hormone. And cabbage, kale, and broccoli helps in healthy cell growth. Healthy cell growth. And grapeseed and green tea are good antioxidant. And calcium D-glucuronate and DF plus also aids in detoxification, sorry. And what is there any other thing that we need to take? Can we have a look? One is called TF collagen. I think most of you know what collagen is. It helps to help our skin better. But this is the only collagen in the world at the moment that has transfer factor. And because of this transfer factor, it is very, very much better than the other collagen. What are the composition? Can we have the next one? So in addition to hydrolyzed fish collagen, we have vitamin C and vitamin E. These are natural antioxidants and they neutralize free radicals. And these are also essential vitamins that support healthy skin, hair, and nails. And vitamin C is needed for collagen synthesis. And vitamin D protects us from absorbing too much harmful UV light. So if you want to have nice, beautiful skin, we also should take this. We should consume 1 sachet a day, mixing with water or any drink that you like. So any of these things that I had mentioned have a special thing called transfer factor, which is a special molecule that can teach our body how to heal itself. So let us take all these things if we want to have better health, better female health as well as skin and as well as beauty. are there any testimonies that we can tell how whether these things work or not? Can we have a look? Okay, there was a lady who was about 60 when she talked to me. She had menopausal symptoms with dryness of vagina and hot flashes for many years. And she did not want to take hormone because she knew that hormones have many side effects. So she had taken many natural treatment for her symptoms, but there was no improvement. In desperation, she rang me and said, "What do you recommend?" So I said, "Well, why don't you try Rio Vida juice, 1 cup a day, and Belvi, 2 capsules a day." After 6 weeks, she felt very much better and her symptoms did not really bother her. So after 2 months, no more worries about her menopausal symptoms. And another patient was somebody whom I had to remove the uterus and both ovaries because of fibroids and endometriosis. At this time, I did not know about transfer factor. So I recommended her to take hormone, and she was scared to stop it even after I recommended her to stop it and try Belvi. So after a year or so, she said, "Dr. Zovi, I will finally try Belvi because I know all the complications that can be caused by hormone." So I said, okay. So she just took 1 Belvi capsule a day, and so her hot flashes had gone. And then she also was on medication for high blood pressure and also have hypertension. Also palpitation. The next time she saw her doctor, the doctor said, "Oh, your blood pressure is much better. So you don't need to take so much medicine for." So she have the blood pressure medication. The next time she went to see the doctor again, medication for blood pressure was stopped. So now she no longer takes high blood pressure medications, and her BP is absolutely normal, and no more hot flashes, no more other menopausal symptoms. And she says that Belvi is a miracle supplement for her. Okay, that's the sharing that I have right now.
All right. Thank you so much, Dr. Zoe, for sharing your knowledge and also the testimony of your patients that you have helped. So let's give Dr. Zoe a lot of to thank her for sharing some good health tips, right? So just want to know if every one of you are still there, right? Just want to make sure. Yeah, thank you so much for giving a lot of 888. Now we would like to have a small quiz time, right, for all of you, okay? And that will be the let me just stop the slides for a while, okay? So just want to make sure all of you are here. If you are here, can turn on your video. So we are going to have a small quiz time, right? Okay, who would like to win some gift, right? We have some small gift to be given away for all the attentive audience tonight, okay? So let me show you what is the gift, right? So this will be the gift that we are giving away tonight. Is still very beautiful shaker, okay, from the immune system company for life, okay. So these are very pretty color. One is in purple, one is in pink, okay. So to get the gift, right, we will have 2 questions for you. Do type the answer in the chat box, okay. So the first question is, okay, are you all ready? If you're ready, please type a lot of 1, 1, 1, 1, 1 if you're ready to win the gift, right? Hit a lot of 1, 1, 1, 1, 1, and I know that you'll be ready, and I will hit the questions, okay? Ready? So everyone is ready, very good. So the questions number 1, please type 2 healthy food that will support our vaginal health as shared by Dr. Zovi just now, okay? So just type 2 of the healthy food. Okay. Wow, you guys are very fast. Okay. Yes. Okay. Apple and honey. Okay. Do we have honey? Okay, yogurt and cranberry. All right. Okay, so the winner goes to, okay, we'll just go on the random view where we stop. Okay, so the first winner will go to Karen Lee. Okay, the first one will go to Karen Lee with the answer of yogurt and cranberry. Okay, let's give Karen a lot of 888. Okay, are you guys ready for the questions number 2? Okay, let's go with question number 2. So the question number 2 is, name 2 supplements that Dr. Zovi shared that will be able to support the woman's vaginal health. Okay, type 2 supplementations that will help the woman's vaginal health. Okay, let's type your answer quickly. Okay. Wow, Revita Juice, you guys are really good students, huh? Everyone is really paying attention. Good answers, good answers. Okay. Wow. Okay, very good, very good. Any more? We are still keeping open for the lucky winners. Okay, and the winners will go to Jenny Peng. Peng, right? Hope I pronounce your name correctly. The second one will go to Jenny Peng. Okay, let's congratulate Jenny as well, our 2 very attentive students for tonight. Okay, thank you so much for your participation. Okay, and our share has not ended there yet. Okay, so let's get back to just now. Dr. Zoe has shared 2 testimonies, right? We have more testimony to be sharing with you, to share. So let me share my screen back once again. Okay. Please let me know if you are able to see my screen. If you can see my screen, please type a lot of 888 in the chat room to let me know you can see my screen. All right, thank you so much, Kaishin, for your response. Okay, so this was the testimony from Mishra. The next 30 years UK trained staff nurse and midwife who is also, hold on, some technical error, just 1 second. She's a very experienced staff nurse and midwife, UK trained, and also gotten her degree from Australia, and also she has been Are you all able to see my screen still? Can you please give me some response? Are you able still to see my screen? Cannot see it now. Okay, thank you, Kaishin. Just give me a minute, yeah. Let me just reshare. Okay, sorry for some technical error. I just started to share my screen. Are you able to see my screen? If yes, please give me a lot of 888 again. Yes, can see. All right, thank you so much. Yeah, so the next speaker, she must be so powerful, right? Until my screen tripped. Okay, so this person is none other than Miss Chua. She's also the nurse who has been very caring for both my Akong and Ama, and I owe it to her very much. And she has helped a lot of patients with this TF throughout so many years. So let's give her a lot of warm welcome, 888, to welcome her to share the case that she has helped with this woman health. Okay, welcome, Miss Chua. Can unmute yourself. Miss Chua, you may unmute yourself. Yeah,
thank you, Pion, for the warm introduction. Yeah, I met this lady. She's a 60-year-old with lichen planus. Means it's a itchy white patch on the vulva, can be quite painful. She developed this very itchy vulva, the surface of the skin, and quite painful as well. And he had follow-up in Penang, in General Hospital in KL, and was advised for biopsy as possible malignancy with 30% cure rate. But she declined and she wanted to try something natural. So I recommended her to try TF Plus with renewal gel to apply on this, the white patches on the vulva. And every day she take one trifecta formula, one TF Plus, one Bio-AFA, one PBGS is spine bug grapeseed, and also one probiotic, which seems to revert her very itchy, vulvar, painful skin back to normal after about 2 months. And then the subsequent follow-up shows that, the skin has reverted back to normal. At the same time, also I advise her to take a low carb with no sugar diet.
All right. Thank you so much, Mishra, for sharing. I bet
you're
that she
welcome.
must be very happy that she didn't have to go through the biopsy and can get some recovery from this natural health regime, right? So thank you so
Yeah.
much. We hope to hear more story from you next time. Thank you so much, Mishra.
Yeah,
So
welcome.
thank you. So the next testimony will come from myself, okay? Because I've been with the VDEX team for over 5 years, and along the line, I also learned from Dr. Wayne, Dr. Tam, and so many great health coaches here. And this is one of the case that I helped. This is a friend which was recommended to me through another friend. So she had this vaginal infection as well. She's a mom to 4 kids, and one day she has this vaginal infection. She feels very itchy, and then she quickly called me and asked me what to do, right? Because it's on Friday night and then the hospital has already closed. She couldn't go to her gynae, she said. So I asked her to try on this cancer factor, the TF, 2 caps and 2 times daily. And after she has taken it for 2 days, when I check on her, like, how do you feel? She says that, yeah, after 2 days, I don't even have to go to see doctors, the itch just go away and she don't have the symptoms anymore. Right? So it is just good that sometimes, we have this natural regime at home, right? We don't have to go to, take the trouble to go to the hospital, right? But this is for certain cases, right? But of course, there are times that when things get too serious, we still need to go and see doctors, right? So do stay tuned, right? Because we are going to have very, very precious Q&A session with Dr. Zovi. You know what? Tonight, when you are here, right, you are already one of the lucky winner. Because why? Normally, when we go for Dr. Zovi consultations, right, it will be at least 150 ringgit for the consultation. But tonight, if any one of you have any questions and that you would like your questions to get picked and be answered by Dr. Zovi's, right, please stay tuned because we are going to have the Q&A sessions on the later part. Okay, right. Yeah, okay, so this was just the voice sharing from my friends to show that she really didn't take any medicine or go to see the doctors, but she was using TF. Okay, so next one we'll go to, right, just now Dr. Zovi has shared about there are few supplements that can help to support the woman's health. Of course, we can have this if you're first time you have not tried and you do not know what are the right combinations, right? You can try this woman's health pack, right, which have this Revita juice and also the TF plus, which some of the testimony have also used on these products, and also of course the woman's precious gift, which is the Belvi that supports the healthy woman's hormone. Okay, this is our woman's health pack. Now another one, if any one of you who would like to have beautiful, youthful looking skin, you can give it a try on this woman's beauty pack, okay, which consists of Revita juice, Belvi, and also the TF collagen, which is a hydrolyzed collagen that easy for body's absorptions, and also it has TF that can boost the immune system as well. Okay, so these are the woman's health and also the beauty pack. And of course, very easily you can go online to order this from our company's website, or you can get the link from your friend who invited you for the talk tonight, that you can easily order online and you can have the free shipping from the company to ship this right to your doorstep and start having your health and your beauty back. Okay, all right. So these are the recommendations from the supplementation that Dr. Zoe has shared just now. And at this point of time, right, like I mentioned, do not just be a doctor yourself, but there are times we need to still consult the doctors, right? So you might be thinking, so when should I see a doctor and when should I not, right? So maybe I would like to get Dr. Zoe to share with you when to actually consult a doctor, when you need to go to see a doctor, okay? So welcome Dr. Zoe once again. Welcome Dr. Zoe.
Okay. So you know how to take care of yourself, but don't be your own doctor all the time. Sometimes yes, sometimes no. So if you have persistent problem, don't just wait and say, okay, I think I will be better soon. If you are not better, you better go see a doctor. So when is the time we should see a doctor? You see a change in the color of your discharge. And what did I say the color should be? Anybody remember? It should be whitish color or colorless. And it should not have any smell. And it should not be a lot that wet your panties. Or there is any redness in the vulva, swelling, pain, and sometimes it's itchy, which can be both in the vagina and in the vulva. You must go and see a doctor, like the lady who had lichen planus. Vaginal bleeding between periods. Usually there should be bleeding from the vagina only during a period, except during ovulation. That sometimes some people have bleeding just 1 or 2 days during their ovulation. That is normal. But besides that, if you have any bleeding, even this can be bleeding after sex, after menopause, or sometime before the mid-cycle and after you have finished your period, or after the mid-cycle before the period starts. So all these things are abnormal bleeding and you should see a doctor. And if you see any swelling or a bulge that comes out in the vagina, this is called prolapse. And sex should not be painful. So many times we said, oh, I feel okay, I don't need to see a doctor. But it is better to have a checkup regularly because, as I had said before, some people have no symptoms at all, and then they get very bad things like cancer. So it is best to have a regular checkup, even if you have absolutely no symptoms. So if your doctor tells you you must come after so many months or so many years or whatever, that will depend upon the findings and your age and all that. So please follow your doctor's advice. That can save you your life sometimes. Okay?
Okay, thank you so much, Dr. Zoe, for your time tonight. Okay, so we will officially start the Q&A session, right? We're gonna have, very lucky, we're gonna have free consultation with Dr. Zoe, but only on the first come, first serve basis, yeah, because we have limited time for tonight. So any one of you, if you're shy to ask, maybe you can type down your questions in the chat box, and then we will get the questions to Dr. Zoe. If there's anyone you'd like to ask, any gynecological issues or any questions you'd like to ask Dr. Zoe, feel free to type in the chat room below. Okay, we have the first questions from Celeste. Okay, so Dr. Zoe, Celeste asks, I want to know how to recover from endometriosis without going through operation.
Okay, here your diet is very, very important. endometriosis is hormone related. And what are the things, the foods that can cause you, that have hormones that you take? Do you know? The ones that have hormones that we take are meat of any kind, milk, cheese, and all these things, especially the ones that are red. If you get, say, wild game, it probably has no hormones extra, but if they are milk, they're pregnant, they will have hormones. So all these things are very high estrogen. So you need to avoid those. And you best to take a plant-based diet. Plant-based means complex, not just the juice, not just a bit of that plant. You need to take the whole plant because fiber is very important. There was one lady who had very bad endometriosis. She had it because she didn't know it was because of that initially. She had been in the war in the Gulf during Saddam Hussein's reign. And after she came back, somebody asked her, what did you miss most? She said, macaroni and cheese. So the friend gave her 48 boxes of macaroni cheese. So she took that every day. And her period started getting painful. And by the time she finished it, the period was very painful. So she went to see her doctor, and the doctor said, oh, you have endometriosis. They had done a laparoscopy. Laparoscopy means a keyhole surgery to see the inside was full of endometriosis, which everything was stuck together. And the doctor said, with this, you can never get pregnant and you're having a lot of pain. Might as well remove your uterus and ovaries. So she said, okay. But in the meanwhile, the surgery could not be done immediately, at least 2 months. So in the meanwhile, one of her friends said, why don't you change your diet? So she changed completely to a plant-based diet. And when she went back for to see the doctor, when the doctor looked at the laparoscopy again to do the hysterectomy, there was hardly any endometriosis. So he didn't do any operation. After that, she had 3 children. So our diet is very, very important. Why I said milk and all this, even if they don't give any hormone to the cows, the pregnant cow has a lot of hormone. And if it is milk, breastfeeding the baby, the calf, is full of hormone as well. So these hormones can cause us endometriosis. So maybe you should try all this diet first before you do anything. Did that answer your question?
Okay, thank you, Dr. Zoe. Celeste, we hope that Dr. Zoe has answered your question. Yeah, Celeste say thank you, Dr. Zoe. Okay, and due to the time limitation, how about we have one more questions from the floor? Yeah, anyone would like to ask the golden questions to Dr. Zoe? Okay, we have the second questions from Rainbow, Dr. Zoe. Okay, the question is...
Okay, please read. I didn't see the whole thing.
Yeah, never mind. I can read to you. Rainbow asks, is it related to hormones that it took 15 days for my period to stop? And during the period time, I feel nothing. I don't feel any pain. She says she don't feel any pain as well.
It is hormone related. And of course, there are some people who have very long period. Some people have very short period, only 1 or 2 days. There are some people who have 10 to 15 days. If that is always like that for you, it is normal for you. Because normal for a person is not the same for everybody. For some people to have period every month is normal. For some people, they have every 2 or 3 months. And if it's always like that, it is normal for them. So no need to worry. But if you become anemic and all that, you just need to make sure there is no pelvic organ problems and hormonal problems. You better go see your doctor and find out what is the problem.
Okay, Dr. Zovi, Rainbow added that this is her first time. So normally her period only lasts for 5 days. So this is the first time that she's seeing that her period is lasts for 15 days.
Did she change her diet? Did she change her place of stay? Any stress? Anything that is unusual for her in her life? Stress can cause problem. Change of diet can cause problem. And if you do not have enough sleep, that can change your hormone as well. So look at your lifestyle and see how it is, whether you have any changes or not, and correct those changes. And if it occurs again with no problem, I mean, no changes in your life or your lifestyle, make sure you go see a doctor to make sure there is no problem.
Okay. Ken, thank you so much, Dr. Zoe. Rainbow, I hope that Dr. Zoe's answer has helped you. Yeah, Rainbow say thank you, Dr. Zoe. So I think yeah, thank you so much. Once again, thank you so much, Dr. Zoe. Can we give her a lot of 888? And also the 888 is for you, right? Thank you, all of you, for spending your time, you know, to stay here and learn a lot of great knowledge from us, right? So, and of course, every other month, right, we are having this Women's Health Talk series, right? So do stay tuned. Do check out with your friends, you know, whenever there's a talk, do ask your friend to send you the link, okay? And we'd like to thank all of you. And of course, the two winners just now, Karen Lee and Jenny Peng, please do PM me your contact number. We'll arrange to get your free gift to you. Yeah, it's the immune system shaker. We hope that the more you shake, the healthier you'll get. Okay, so thank you so much, everyone, for your participation. We hope that everyone stay healthy and stay youthful, because all of you deserve it. Okay, good night, everyone. Thank you.
for coming.
Jenny and Karen, I'm waiting for your DM. Yeah. Thank you, everyone. Thank you, Dr. Zoe.
Thank you for hosting.
My pleasure. Thank you, Dr. Zoe.
Okay, let us have a good time next time.
Yeah, maybe Dr. Zoe and Miss Chua, both of you can stay on for a while.
Okay.
Thank you.
Hi, Fionn, Dr. Zoe, good job. I think Karen's and Jenny is still here, so not sure you can hear us, because yeah, I just
Do they want to ask something?
if not, I put them in. Hopefully they'll give you. Have they sent you the number? So Fionn, you're muted.
Yeah, I got the reply from Jenny and Karen's already. Yeah.
Oh, very good. So let me put them in waiting room so that we can continue our discussion.
Yeah. Thank you, everyone. You may go proceed to have a good night's sleep. We'll see you again in the next talk.
All right. So
Okay.
we are.
Thank you so much, Kang Chai, for